Hi, everybody. Welcome to Chapter 17, the Reproductive System Diseases and Disorders. Today, we are going to cover quite a bit of material. So I'm going to go ahead and get started. So I think most of you are familiar with the anatomy and physiology of both the male and female sexual organs, and just keep in mind that some are external. This is a list of the female external structures. These are ones you can see without doing a scan or without doing an internal examination. The internal structures of a female include the ovary, the fallopian tubes, the uterus, the cervix, and the vagina. And the two most important female hormones are estrogen and progesterone. The male structures, the ones you can see, of course, are the scrotum and the penis. But there is quite a bit of intricate internal structure going on in the male anatomy, and it includes the testes, the epididymis, the vas deferens, the urethra, the seminal vesicles, and the bulbourethral and prostate glands. So we kind of switch back and forth between male and female at the first part of this, and then we will get into more specific diseases for each of the sex. So for females, most of the time, the signs and symptoms of their reproductive system, the first one, of course, will almost always involve abdominal and pelvic pain. When we talk about the pelvic floor, it means they will tell you it feels like something is pushing down between their legs. Usually these are adopted along with fever, malaise, possible vaginal discharge, burning, pain during sex. And keep in mind that the breasts are also considered reproductive organs. So anytime there's an abnormal discharge from the nipple, that is also considered a reproductive female disorder. So for males, it tends to start as a urinary disorder, frequency, painful urination, urinating a lot at night, possible incontinence. They'll feel pain in their pelvis, their groin, and their reproductive organs. A lot of times it will indicate as swelling first, or they can see maybe a lesion, or they'll have burning and itching. And of course, anytime there's abnormal penile drainage, that is an issue for a male to seek treatment immediately. So how do we figure out what's wrong in females? The first thing they're going to want to do is an examination, and it usually is a bimanual examination where the doctor will palpate the abdomen externally with one hand and do an internal with the other hand, and they can basically sandwich the female organs between the two hands and feel for growth, feel for things that are out of place, that type of things. A hysterosalpingogram, that's where dye is injected into the fallopian tubes to see if there's any blockage, pap smears of the cervix, cervical biopsies, and cone biopsies. A cone biopsy is where they take a little instrument and just scoop out some tissue. They can do it for any part of the uterus, the cervix, the vagina. It's just another way of biopsying for abnormal cells. They can do dilation and curettage. This is commonly known as D&C. We will see it as a treatment for many of the diseases. What it involves is dilating the cervix and then going up and scraping the uterine lining out. It's not considered an invasive procedure since it is done without having to make any incisions, but the patient usually is under anesthesia while it's done. A laparoscopy, they can use a laparoscope to see what's going on with the patient, mammography, and of course there's a lot of different blood tests that they can use for hormone levels. They can just do, general overall body functions and see what's going on. They can do a CBC. That can tell us a lot about what's going on with a woman also. This is just a picture of how they do a laparoscopy. There are two small incisions. One uses the laparoscope. The other one usually has usually clippers, things that they can do to check things out. But the laparoscope literally allows the physician to look all through the abdomen of the female to see if there are any abnormalities. So when we switch and go to diagnostic tests for males, a digital rectal examination, reason they can do that is if there's any enlargement or herniation, they can feel that through the wall of the rectum, since the inside sexual organs of the male are in very close proximity to the rectal area. They can do cytoscopy, which is scraping cells and sending them for biopsy. They can just do regular biopsies where they can take a chunk of tissue. They can do, of course, various laboratory tests for hormone levels. Probably the most common one for men is prostate-specific antigen tests. And I want to highlight that word. It's not prostrate, okay? P-R-O-S-T-R-A-T-E. That means lying down. Prostate has to do with the prostate of the male, okay? So there is no R when we are talking about prostate-specific antigen. All right, we're going to flip to female reproductive system diseases. We're going to start with PMS. These are symptoms prior to the start of your period. They usually begin anywhere starting mid-cycle, which for most people is the end of week 2 after you've had your last period. These are symptoms that women have commented on, expressed, and we are actually finding that there are hormonal reasons for most of these symptoms now. They tend to begin mid-cycle, as I stated before, and we have found that a lot of them can be, I wouldn't say completely eliminated, but they can be lessened by avoiding caffeine, chocolate, nicotine, salt, sugar, and alcohol. However, some people have modified their diets exclusively and they still have them, so it's not something that can go away completely. So some menstrual abnormalities. These are 4 words that are very common. Amenorrhea means an absence of a period. Dysmenorrhea means extremely painful periods. Menorrhagia means excessive or abnormal flow, and I should have put during a period. It means just a very heavy flow when a woman gets her period. And metorrhagia is abnormal bleeding between periods. This can be as little as spotting, or this can be a very heavy flow between periods. So menopause is considered the natural halting of menstruation. Okay, it's not a disease, it's just a normal physical change related to aging that all women go through. It usually takes place between the ages of 40 and 50, and sometimes it takes a while. It is officially called when a woman goes for 1 year without having a menstrual cycle. So you could have 1 year where you have 2 menstrual cycles, you could have 1 year where you have 4, but as soon as you go full 12 months without having a menstrual cycle, it's considered menopause. And I'm sorry if you hear the laundry in the background. My daughter put a load of laundry in while I was recording this. However, menopause can be surgically induced at any age by removal of both ovaries. I had an emergency hysterectomy after I had my second child. So they left an ovary in. They had left one in. One was damaged. So I technically wasn't considered in menopause. However, I did experience a lot of the similar symptoms of menopause. And then the other ovary got bad when I was 39. So that is when they took the second one out. So I technically went through menopause starting at age 39. So if a woman has both of their ovaries removed, they are going to start going through menopause. The symptoms vary. It can be hot flashes, night sweats, vaginal dryness, and for some women, it can be very, very, very depressing because um, they just weren't ready to go through it, or especially if you have to have it done, or if you have surgery and it's done earlier. Um, you'll see a lot of women who are depressed. They're having trouble sleeping, decreased sex drive, and the sleep disorders come because of the night sweats. Women can wake up 5, 6, 7 times a night completely soaked and have to change, that type of thing. So the final diagnosis, if a woman needs it, is they will do a blood test for the presence of follicle stimulating hormone. If that is no longer there, then they know the woman has gone through menopause. So treatment for menopause has varied greatly over the years. Um, MHT, or menopausal hormone therapy, um, used to be very widely prescribed, and then they found that it may be causing to an it may be adding to the cause of breast cancer. So they are very careful with prescribing this now. They will do a strict history, and if anyone in your family has had breast cancer, they will not allow you to, they won't prescribe you menopausal hormone replacement therapy. So let's switch out of menopause into vaginitis. And this is any inflammation of the vagina. It can occur from many different things. The two big causes are bacteria and yeast. A patient usually presents with the fact that they've got burning, itching, maybe they're swollen, okay? Um, One of the questions we'll always ask them is, do you have any discharge? What does it look like? If it looks like white cottage cheese, it's probably yeast, candida. So we will test the vaginal pH. We can do some culturing. And once we identify if it's bacterial or if it's yeast, we will give the appropriate medicine for it, okay? One of the things we always tell people is abstain from sexual intercourse until the condition has healed. The reason for that is you can give it to a male partner and they can be asymptomatic, but then they can give it back to you a couple weeks later if you have sex before you're completely healed. So the common types of vaginitis are a yeast infection from Candida. So you can see that some people will say a yeast infection, some people will say a fungal infection. Those are the same thing. Trichomonas is a parasite. Um, Atrophic is what occurs in postmenopausal women because of the lack of lubrication during sex. You can really irritate the inside of the vaginal lining. That is why when you are postmenopausal, you are encouraged to use a lubricant of some type so that you do not injure the inside walls of the vagina. So endometriosis, this is actually very common problem with younger women. It's an abnormal growth of endometrial tissue outside of the uterus. The common implantation sites are the ovaries, the fallopian tubes, the abdominal wall, and the intestine. So somehow the endometrial tissue is getting outside of the uterus and it's literally sticking somewhere it shouldn't be. Okay. The trouble is, once it's implanted somewhere it's not supposed to be, it's still under the hormones of the female. So it can produce cysts, scars, adhesions, many different things. The biggest symptom is dysmenorrhea or very painful periods. You can have low back, vaginal, pelvic cramping, very heavy menses, dyspareunia. This means painful intercourse. Probably the biggest primary complication is infertility. Okay. It can be treated with hormones. A lot of times they will put females on birth control pills so that it limits the amount of endometrial lining which is allowed to grow. It can go into remission with pregnancy, nursing, and menopause. And a hysterectomy is also another option. So PID, or pelvic inflammatory disease, is an inflammation of some or all reproductive organs, okay? So it can include the cervix, the endometrium, um, the fallopian tubes, the salpingitis, or the oophorytis, which are the ovaries, okay? It is some type of inflammation. And a lot of times the cause is unknown, but the most common cause is a sexually transmitted disease. Now, I also want to tell you that you will see STDs also referred to as STIs now, sexually transmitted infections. It can be, the words can be used interchangeably. People of my generation tend to use STDs. People of the younger generation will use infection because they prefer that over the word disease. So PID usually presents as fever, chills, pelvic pain, and leukorrhea, okay, or pussy discharge. The treatment is to find out what is causing the problem. It's usually bacterial, okay, and pain medicine and rest. And the big prevention of getting PID is to avoid an STD or an STI in the first place. So practicing safe sex with proper use of condoms. Okay, an ovarian cyst. This is a common benign fluid-filled sac on or near an ovary. Okay, there are two types. Physiologic. Physiologic means that when an egg is released by the ovary, it becomes the tumor or the benign fluid-filled sac, okay, the cyst, or it can be a neoplastic. It can become from a different type of cell, okay? Again, these will present with lower back pain, pelvic pain, dyspareunia, okay, which is again painful intercourse, nausea and vomiting, okay? Depending on the size and type of it, it may resolve itself or it may require removal by laparoscopy. Fibroid tumors are different than uterine cysts, okay? These are also known as leiomyomas. It's a benign tumor of the smooth uterine muscle. So we are now in the uterus, okay? It's the most common tumor of the reproductive system. So it is occurring within the actual uterus, okay? The symptoms are abnormal uterine bleeding, excessive menstrual bleeding, and severe pain. It can be one of the big things is when women are bleeding between their periods. This could be one of the big possibilities. So the treatment depends on a woman's age and, desire for children. If it's a bad tumor and you're done having kids, women will often opt for just the hysterectomy so that it doesn't occur again. But if you're young and you want to have children, many will opt for just the surgical removal of the actual fibroids. So toxic shock syndrome doesn't get talked about a lot, but it really does occur. It occurs mostly in the lower socioeconomic classes who do not have a lot of money for disposable female products. We also see it in underdeveloped countries where they use homemade tampons, okay? It's a severe life-threatening illness. It's found almost exclusively in menstruating females using tampons, okay? When it happens is when the tampon is left in too long. And it can be a number of reasons. It can be you completely forgot about it. It can be that you don't have enough of them to change as frequently as you need to. Or, as I stated before, women in underdeveloped countries where they don't have disposable products will use homemade tampons, and they will leave them in until they are bled through rather than change them regularly. And what this allows is for Staphylococcus aureus to grow inside the upper level of the vagina, and it can spread to any parts of the female system, and you become septic from it. And so it occurs. One of the symptoms is a very sudden high onset fever and vomiting in a menstruating woman. Okay. Now, if you're a female and you forget once in a day, it's probably not going to be bad. It's when it's done on a regular basis. A couple more symptoms are diarrhea and decreased blood pressure. So it is imperative that we get women who have this problem treatment immediately. Usually we will replenish their IV fluids. They're given IV antibiotics so that they don't go septic, and then they are usually given oral antibiotics to follow up. So a uterine prolapse, this happens when the uterus protrudes through the cervix into the vagina, okay? It's usually when people have had a number of children, okay? The uterus does not stay as muscular and in place, and it will kind of sag with gravity. But when part of it starts coming through the cervix into the vagina, okay, it can be very painful. You'll feel, like I said, that heaviness in the pelvis, or people will tell you that when they're sitting, they feel like someone is pushing down through their body to the floor. It causes problems with urination because it's all interconnected. Very painful urine. People will tell you that it's just an awful back pain. Again, this is picked up by usually ultrasound, and the treatment is hysterectomy. If someone is very young and they still want to have more children, they can try to pull it back up and reattach it to the abdominal wall, but it tends to weaken the uterus and make it difficult to carry another child to term. Cystocele, okay? This is a herniation of the urinary bladder through the anterior vaginal wall, okay? So your bladder is, think about it, your bladder and your urethra are in front of the female vaginal wall, okay? From front to back, it's the urinary opening, the vaginal opening, and then the anus, okay? So a herniation of the urinary bladder, okay, that doesn't mean the bladder is completely pushing through the vagina, okay? It means it's pushing on it and making both the bladder wall weaker and the vaginal wall weaker, okay? So what will happen is you'll get an incredible amount of pelvic pressure. You'll get urinary urgency, frequency, incontinence, okay? Depending on the degree of herniation, you can do exercises, Kegel exercises, which strengthen the pelvic floor, or they may have to do surgery. So this is very common after pregnancy. This is very common later in life when the urinary bladder is not as muscular. So rectocele is the complete opposite, okay, of cystocele. This is a herniation of the rectum through the posterior or back vaginal wall, okay? And again, it's not like the rectum pushes completely through to the vagina, or the vagina pushes completely through to the rectum area. It's when there's pressure and both the walls weaken, okay? So the symptoms are discomfort. A lot of times there's constipation, and it can range from constipation to fecal incontinence, where people cannot hold their bowels. And most likely this one always requires some type of surgical repair. Now we're going to talk about cervical cancer. The most common cause is human papillomavirus, okay? And the symptoms are abnormal bleeding, and most of the time they want to get rid of the tumor, okay? But what I will tell you is I'm a big fan of the HPV vaccine, which they usually start around age 10 in both males and females, because if we can eliminate human papillomavirus, as you will see through the next slides, we can eliminate a lot of things, okay? So for cervical cancer, hold on one second, yeah, for cervical cancer, the risk factors are beginning sex at an early age, multiple sex partners, smoking, sex with males who smoke, sex with males who have a spouse diagnosed with cervical cancer, obesity, excessive alcohol consumption, because they all lead to mostly unprotected sex, okay? So if someone has cervical cancer or HPV, okay, they can pass it along. So prevention, okay, is to reduce your risk factors. Obviously, the most important thing is have safe sex. Okay. This is why we have yearly pap tests. Okay. Because we are trying to eliminate cervical cancer and get the HPV vaccine. So uterine cancer is different than cervical cancer. Okay. The cervix is a thick muscle that has a very narrow opening at the top of the vagina into the uterus. Okay. The uterine cancer is only in the uterus. Okay. It usually develops in the endometrium and spreads into the uterine wall. The uterus has a couple different layers. Okay. Again, abnormal bleeding in postmenopausal females is one of the biggest indicators. Okay. But it can happen in non-menopausal females also. So surgical removal of the uterus and ovaries, and a lot of time radiation therapy, and this cancer can be beat. When we switch to ovarian cancer, it's unfortunately quite common and often fatal. Again, the symptoms are pressure on the bladder, abdominal pelvic plane, just a general overall feeling of ill health. Okay. The treatment is a complete hysterectomy, and a complete hysterectomy involves the ovaries, the fallopian tubes, and the uterus and the cervix. Okay. So a partial hysterectomy usually just involves removal of, say, the uterus and the cervix. Okay. Radiation, chemotherapy, but again, the prognosis for ovarian cancer is not nearly as good as uterine cancer. So these are diseases of the breast we're going to talk about now. Fibrocystic disease is the most common breast disorder in premenopausal females between the ages of 30 and 55. Okay, and these are cysts which are linked to estrogen levels. Okay, the treatment is to reduce the pain. Okay, reduce caffeine and salt, use mild diuretics, get the extra fluid out of them, use mild analgesics the week before menstruation. Mastitis, on the other hand, is an inflammation of the breast tissue. Okay, they become red, they get very warm, they swell, it's very painful. There can be a bloody nipple discharge or possibly a little bit of pus discharge from the nipple. Treatment is antibiotics, application of heat, again, some analgesics to reduce the pain, and a firm supporting bra to decrease comfort. Whoops. Mastitis occurs very frequently in nursing females. It becomes one of the breast glands gets clogged and becomes infected, and you can't get any milk out, and oftentimes the breast will swell. Which makes it even more uncomfortable because getting it into the firm supporting bra to decrease discomfort isn't going to happen because it's not going to fit. So just keep in mind that this is a very prevalent inflammation that occurs during breastfeeding. Breast cancer is usually caused by adenosarcomas. Okay, it's usually in the breast ducts. It's the most common breast neoplasm or cancer forming cell. Okay, again, age 40 and over, which is why we start mammograms at age 40. Risk factors go up. Your chances go up if you have a family member affected with breast cancer. That's usually considered a grandmother, sister's mother, or aunt. Okay, and they've also found that people with early onset of their period also have a higher risk for breast cancer. Some more risk factors are if you go into menopause late, if you've never had any children, if your first child has been over the age of 30, if you're obese, if you have chronic breast disease, infections, cysts, and if you wear a bra too often, believe it or not. So for breast cancer, usually you'll find a non-tender lump. Usually the lump itself doesn't hurt, okay? So it occurs most often in the upper outer quadrant of the breast. So I always say the quadrant of the breast that's closer to your armpit and closest to your face, Okay. Dimpling can occur because excuse me, I'm going to sneeze. It's allergy season. Dimpling can occur because when the cancer lump forms, it tends to shrink and suck all the cells out of the area. So you'll see a little bit of dimpling or imploding in that area. Treatment of breast cancer. The none of these are exactly great, but if you have to have it done, a lumpectomy means they just remove the cancerous lump. That means it hasn't spread to your lymph nodes or anywhere else in the breast, okay? A mastectomy is complete removal of a breast and the surrounding lymph nodes, okay? Both of these are often followed up with chemotherapy and radiation. Now we're going to switch to some disorders of pregnancy. An ectopic pregnancy is when the fertilized ovum attaches to tissue outside the uterus. It usually attaches to the fallopian tubes. So someone will have a positive pregnancy test, but they are in acute pelvic pain and vaginal bleeding. It is diagnosed also using sonogram. Okay, so usually they have to surgically remove it to terminate the pregnancy. Every effort is taken to preserve the ovary and tube if future pregnancy is desired. Sometimes they have to sacrifice the ovary and the fallopian tube, but hopefully the patient's other ovary and fallopian tube will be working. So this is just a picture of where the ectopic pregnancy occurs in the fallopian tube. The ovary releases the eggs, and I always say the fingers of the tube kind of catch it, and it gets fertilized while it's in there in the fallopian tubes. That's normal, but what happens is it just doesn't move down and impregnate into the uterine tissue, but it keeps developing and growing, and there's not enough room in a fallopian tube. So let's talk about the word spontaneous abortion. This is also known as a miscarriage, and the medical term for it, spontaneous abortion, can get people riled up, and miscarriage sounds a little nicer, okay? It is when nature terminates the pregnancy before the fetus is viable, okay? Usually it starts with vaginal bleeding, cramping, and pelvic pain. So if it starts, they will put women on bed rest and attempt to save the pregnancy. But once the miscarriage starts, it's often difficult to stop. And when it's over, a lot of times women will have to have a D&C or a dilation and curettage. So to make sure that all of the material has been removed from the uterine lining, if it's not all expelled during the miscarriage, it will cause a bad infection. So morning sickness is usually associated with the first trimester of the pregnancy. However, it can occur the whole time, okay? Nausea and vomiting, and there's usually no treatment unless it's very excessive vomiting. They say to eat light meals several times a day, dry food before drinking, so that's why a lot of pregnant women carry saltine crackers, avoid fatty foods, and rest after meals. Hyperemesis gravidarum, I can never say that word. This is excessive vomiting during pregnancy. This is when you're throwing up so badly that you get dehydrated, you lose weight, there's possible electrolyte imbalances. And women who have this problem during pregnancy will be given IV fluids, and they will withhold all foods and oral fluids until they can get the vomiting to stop, okay? Usually it subsides by the second pregnancy. Sometimes it does not. So people who have this in their first pregnancy are usually very cautious when they get pregnant the second time, okay? The most common person that had this problem was Princess Kate in England. toxemia can appear during the third trimester. This is why we are constantly monitoring blood pressure in pregnant women, their weight, okay? And we're not talking about the normal weight that you put on during a pregnancy. At the end of a pregnancy, your baby is rapidly growing, so you're supposed to put weight on. But if you put on, say, 10 pounds in a 2-week period, you're holding water, okay? They will, every time a pregnant woman comes in, they bring a urine sample. There should be no protein in your urine. If there's protein in your urine, they know that you are probably entering pre-toxemia. Swollen face, hands, and feet. Again, pregnant women's feet tend to swell, but when your face and your hands become involved, then they worry about toxemia. They usually put you on bed rest. You may end up being hospitalized because if they have to monitor your blood pressure, your weight, and your urine protein, they may need to have you in a hospital for that. Okay. So another disorder of the pregnancy can be abruptio placenta. Okay. So this is when the placenta separates from the uterus before it's supposed to. Okay. The placenta is supposed to separate after birth. Okay. But if it starts to separate before birth, okay, then we need to determine what degree of separation has occurred. If only part of it has separated, you may never know, okay, or you may have some of the symptoms. But if a complete separation occurs, okay, it's going to cause severe abdominal pain in the pregnant woman, vaginal bleeding. Many times they hemorrhage, which causes them to go into shock, and the baby's heart rate goes down. So if this happens, they will do a prompt delivery, usually by C-section. Sometimes they can get the baby vaginally delivered, but most of the time it's a C-section. And because of the increase in hemorrhage, the mom may need a blood transfusion. So that was abrupto placentae. This is placenta previa. Okay, this is when during the pregnancy, okay, the placenta abnormally positions itself in the lower uterus. Okay, it is usually, the placenta is usually attached high in the uterus. Okay, the symptoms can be painless bright red vaginal bleeding during the third semester, which scares the crap out of pregnant women. Okay. They may put them on bed rest. They may just keep them monitored. Okay. If the bleeding isn't severe or they're not having too many symptoms, they may allow a vaginal delivery, but usually they will do a C-section if the mom is bleeding profusely, or if the baby's heartbeat is going down and they are determining that the fetus is not getting enough oxygen. All right, so we're going to switch from males to from the females to the males. Okay, prostatitis, that's an inflammation of the prostate gland. The symptoms are painful urine, or there's pus in the urine looks cloudy. They could have fever, low back pain. Of course, we try to do a culture, get them antibiotics. We push fluids so that we can clean the, for lack of a better term, clean the entire tubing system of the male out, since it's much longer than the female system, and pain medicines. BPH, we hear a lot about this on TV, okay? This is enlargement of the prostate gland due to normal cells overgrowing and enlarging. It's very common in males over 50, okay? The first sign of BPH is nocturia. They're getting up constantly at night to pee. Another symptom is that they have trouble starting to urinate, or maybe they feel like they have to go very badly and only a tiny dribble comes out. A lot of males will say, I feel like I have to pee all the time, and that's because the enlargement is not allowing the bladder to empty completely. So the treatment, excuse me, is prostatic massage, sitz bath. Okay, that's a warm bath that allows the the urethra to hopefully relax and open up. Catheterizations, if it becomes too big. Regular sexual intercourse can help with that, and surgery to remove the large bulge that is causing all the issues. So this is an example of how they go in and resect the prostate. It's called a TURP procedure. Okay. What they're doing is cutting the enlarged pieces of the prostate out. Okay. Another male reproductive system disease would be prostatic carcinoma. Okay, these are neoplasms of the prostate gland, usually affects males over age 50. It's the second most common cause of cancer-related deaths in males. The symptoms are similar to BPH. The treatment depends on the age, the physical condition of the individual, and the degree of metastasis. Epididymitis is inflammation of the epididymis, okay? It will look swollen, hard, it will be very painful. Usually there's severe scrotal pain and swelling. So treatment is rest analgesics. They can use a scrotal sac support, and they try to calm the area down and cool it off by not using alcohol, spicy foods, or having sex. Orchitis is an inflammation of one or more of the testes, and it can be due to a viral or bacterial infection. The symptoms are, of course, swelling is the big thing, pain, tenderness. It can be in one or both. The treatment actually depends on the cause. If they can determine it to be bacterial, they're going to give antibiotics. If it's inflamed due to injury, they're going to put bed rest, pain medicine, a scrotal support sac, ice. Testicular tumors mostly affect young males, believe it or not. And it's usually painless, but they'll feel a mass at some point. So the treatment can be, they can remove the testicle, or they can opt for chemotherapy or radiation. Cryptorchidism, this is an undescended testicle. Okay, it's very common in premature births because one of the last things that develops in utero for a male child is for the testicles to descend. So in preemie births, a lot of times they will give it some time. Okay, they will give it 3, 4, 5 months. And if it doesn't descend after that, they will do surgery. But they usually don't panic if a male child is born with one or both testicles undescended. Okay, they usually try to give it some time. So this just shows how it has not descended to the normal position yet. So let's get into sexually transmitted diseases. Again, they have also been called sexually transmitted infections. Either phrase works. I usually call them STDs. They were formerly called venereal diseases. They are a group of many diseases spread by intimate or sexual contact. And when I talk about intimate or sexual contact, you don't have to have full-blown sex to get these things. It can be passed off by oral sex, many different varieties of different type of sexual contact do not involve the complete act of sex. So just keep that in mind. The treatment is commonly consistent of identifying your sex partner and treating the infected individuals. Prevention of STDs, of course, is avoid it or to practice safe sex. Okay, one of the big reasons STDs are allowed to propagate is when one partner finds out they have an STD, they may be unwilling to go back and tell the previous partner that they had it. That is the best thing you can do, because then that patient gets, or that person gets treated also, and hopefully it stops the spread of that disease in those two individuals. So AIDS is a sexually transmitted disease. We talked about it in chapter 5. It's a bloodborne viral infection. Hepatitis is also an STD, okay? Um, it's not the only way you can get hepatitis, but you can get Hep B and C by sex. Herpes is probably the big one. It's a viral infection of the mucosal membrane. You will see blisters, extreme pain, itching, painful urination. If you have symptoms, they will treat you with antiviral medications, sitz baths, which are cool baths to hopefully cool off the lesions, ice therapy, analgesics. So there's no cure, but they can work on the symptoms. And then you can enter an asymptomatic phase. Okay, gonorrhea is one of the most common STDs in America. Okay, its cause is Neisseria gonorrhea. It's a bacteria. So the symptoms again are pussy discharge, painful urine, frequency, a lot of urinary tract infections. Signs mimic the same as gonorrhea. Okay, so a lot of times they will ask for a urine sample, and they'll ask for 2 different kinds of urine samples. They will ask for what they call just a regular urine sample, what we in the lab call a dirty one. So they'll ask you to pee in a cup, and then they'll ask you to stop maybe halfway, then do a really good cleaning of the external urinary area and try to get what they call a clean catch. And so they'll use the cells in the first urine sample to do a DNA test for gonorrhea, and they'll use the second urine sample to determine if it is a urinary tract infection. Okay. Again, always want to get an STD fixed because, especially in females, it can just work its way up through the reproductive tract and cause a lot of infertility. So for gonorrhea, they usually give penicillin, tetracycline, or ceftriaxone. Syphilis, this can be a chronic life-threatening STD. It's called by Treponema pallidum bacteria. So the first phase is you get a chancre, okay, or a lesion. Secondary phase is the rash, or the chancre heals, but then you get a rash. The third stage is the tertiary stage, okay? This can last for 6 weeks to a year. So this is when the bacteria invade other organs throughout the body, okay? And it leads to I would say a syndrome called GAMA, okay? It is curable with antibiotics during any of these first 3 stages. If it doesn't get cured after the first year, okay, that's when it leads to a lot more problems. So again, penicillin, tetracycline, okay. Chlamydia is very common, but chlamydia is a very, very damaging STD. It's called the silent STD because it makes people infertile, okay. It's caused by chlamydia bacteria, okay. Again, it can mimic a urinary tract infection, okay. So a lot of times you'll get the same thing. Dude, give me 2 different samples. Give me one before you've cleaned and one after. The reason they want the first one is because there's a lot more cells in that one and they can do DNA testing on that. Again, treatment is antibiotics. Trichomoniasis, this is a common STD, affects approximately 10% of all sexually active individuals. It's caused by a protozoan, Trichomonas vaginalis, okay? Males often don't even know they have it. If they do have it, usually it's only an inflammation of the urethra. It can also, if it's left untreated, it can inflame the epididymis or the prostate. Females tend to get itchy and burning, and they can sometimes get a green frothy discharge. So that's why we're always asking, what color is it? Does it have a smell? That type of thing. The treatment for this one is to give an anti-parasitic medication. Genital warts. Okay, genital warts are warts that affect the warm, moist tissue of the genital area. And again, the cause is the human papilloma virus. So again, if you get the vaccine, you don't get genital warts. Okay, they can be removed chemically or surgically. But if you have HPV and get warts, then your increase in cervical cancer is much, much increased. So again, get the HPV vaccine. Dyspareunia, okay, this is called painful intercourse, okay. It affects both males and females. There can be physical or psychological reasons to it. So it can require counseling. It can require a good examination depending on what the cause is, but most of the times it can be fixed. Female arousal dysfunction, also known as frigidity. It's a lack of having sexual desire, or you're unresponsive. It can be often due to neurologic and psychological conditions. The main symptom is the inability to reach an orgasm. So treatment can be, a lot of times it is psychological treatment also. Maybe something bad happened to them, or maybe they were taught that it was not a good thing. But they've done a lot of work with this they've done a lot of good, complete work with this issue. Impotence, or commonly known as erectile dysfunction. Okay, we see a lot of this on TV. Okay, the inability of a male to achieve or maintain an erection to complete sexual intercourse. It does not affect fertility. Okay, um, it can be caused by a couple of different things. It can be caused by vascular insufficiency, so it's not getting enough blood to that area to be able to achieve and maintain the erection. Again, it can also be caused by psychological factors, something that happened to them or something that someone said to them at some point. Okay, so it can be caused by a change in medication. A lot of times they can be given a medication for another problem within the body, and impotence can be a side effect of that. It, a lot of times they will give psychological counseling. They will change the medication. If it's a physical problem, they can do surgery. Okay, they can have internal and external devices which can help in this area. And of course, the big thing is the little purple pill, the medications. So it may not be preventable. Okay, activities related to a healthy lifestyle may aid in prevention. In other words, staying active as you get older, if you're a male, tends to help this not occur. Premature ejaculation. This is when the seminal fluid is expulsed prior to completing sexual intercourse. It can happen before there's even an erection or during foreplay. It's the most common sexual problem in young males. Okay, it's usually a psychological problem rather than a physical problem. Again, most young men outgrow this. But again, the treatment can be based on a cause, a specific cause. It can also include some psychological therapy and just educating young men. Infertility is the inability of a couple to achieve pregnancy. The female causes could be any of these listed things: STDs, hormones, physical abnormalities, endometriosis, issues with the fallopian tubes, or vaginal antibodies that kill sperm. Male causes can be, an infection or an STD, a structural abnormality, a hormonal disorder. So usually the first thing, if a couple presents and they are infertile, is they will have the man present a semen sample. Reason being is that is not a non-invasive technique. Neither partner needs to have surgery in order to determine if that's a problem. After that, then they'll usually do blood work on both people. They may do fertility drugs. They may do surgery if it's an actual physical anatomical problem, okay? And they can also do artificial insemination. Rape is obviously a very, very traumatic event for the person who is raped. Um, any age and either sex. You may see rapes in children, you may see rapes in elderly people. It occurs across the board and it does not discriminate. Okay. It is considered vaginal or anal sex without the consent. There's a very high incidence. Okay. It is going even higher because we have date rape drugs. The recovery is very difficult. So if you encounter someone with this, keep in mind they're not only dealing with the trauma of being raped, they're dealing with possible STDs. If it's a child, they're dealing with possible trauma to their organs. If it's an elderly person, they are dealing with injury, usually also. Um, and even if it's a younger person, a lot of times there are injuries to um, the areas. So please keep in mind that rape is very, very difficult, and to be as kind and let the patient lead the examination. At any time, if they want to stop, let them gather themselves. Um, and they will be very, very, very embarrassed, very angry, very humiliated. Vaginal cancer, okay, this is very rare, okay. DES was a synthetic estrogen that was prescribed to women between the years of 1938 and 1971. It was prescribed to women who could not carry a baby to full term. So they thought it had to do with the estrogen. So they gave them this drug, and many times the mother did carry to full term. The problem was somehow, some way in utero, okay, if there was a if it was a baby girl that those mothers were carrying, okay, they suffered reproductive issues. The baby suffered reproductive issues later in life. They found out for women who used this drug in the first 5 months of pregnancy, many times their daughters had severe reproductive issues. Okay, so, and it also led to vaginal cancer. Okay, so the treatment was key. Again, history, you've got to know history. Okay, but again, many people who were born from 1938 to 1971 still don't have their moms around, so they can't ask them. Puerperal sepsis, okay, this is an infection of the endometrium following childbirth. That is why when you deliver the placenta is sent to pathology so they can determine that it all has been delivered. It can be a problem with home births because maybe the placenta has not been completely analyzed, okay? So if a piece of the placenta is still left inside the mother after childbirth, it can cause a severe infection. Okay, so again, antibiotics, they want to make sure that you're using aseptic technique during and after childbirth. Okay, um, that the placenta has been delivered completely. We tell pregnant women, wash your hands before you go to the bathroom and after you go to the bathroom so that you are not introducing anything that's on your hands to that area during urination. Hydatiform mole, these are grape-like cysts in the uterus that mimic a pregnancy. Okay, the treatment is D&C, and you're at higher risk to develop choriocarcinomas. Okay, so if you have these moles inside your uterus, you're going to require very frequent follow-up examinations. We always end with the effects of aging. So for female, the effects on the reproductive system are listed here. The biggest one I would say is the fourth one down, the decreased vaginal lubrication, which can be um, alleviated using pre-purchased products. They require greater stimulation, and breast atrophy. And by that I mean the skin and the tissue in the breasts tends to atrophy. So that is where the sagging tends to happen. Effects of aging on male, okay, the decreases in testosterone and sperm, okay, decreased in elasticity of the skin, okay. Again, possibly they might need greater stimulation, okay. And the big thing for males is the enlarged prostate. So that is why they are screened yearly for that. All right, everybody. Thank you and have a great day.